a short summary on the highlights on the sarcomas. I will start with the soft tissue sarcomas. What was new here? We had two interesting presentations on dedifferentiated liposarcomas with two combinations of drugs. The one was targeted therapies with Siremadlin and Ribociclib. These are CDK4/6 inhibitor and MDM2 inhibitor. And in this first study, this was the study from the final analysis from the MEGAMOST study with the subgroup analysis on this subtype, and specific genetic profile was a basis for choosing the patients for this study with different molecular alterations that are involved in the pathways. And promising results were shown here with long median progression-free survival of about 8 months and a long median overall survival of 23 months for the subgroup of patients with the differentiated and well-differentiated liposarcomas. Then there was a second study also on the CDK4/6 inhibitor, but another one, this was Palbociclib combined with an immune therapy, Retifanlimab. This was a phase 2 trial also in dedifferentiated liposarcomas. And here we had a promising overall response rate, so that also here the primary endpoint of the study was met. The same is for the previous study, and a very promising overall survival rate of nearly 25 months. So let's see what will happen further when this combination of drugs is used in this subtype. What also was a very interesting study that was presented on Monday was the EREMIS trial. This was a study on assessing the efficacy of a maintenance therapy with regorafenib after the usual treatment we give with doxorubicin. And here also the primary endpoint of the study, that was my median progression-free survival, was met when the medication was tested against placebo. Of course, we have to balance these results against the side effects that we are aware of when this medication is used. But this is a possibility, of course, to proceed with our patients after receiving the standard first-line treatment with doxorubicin. Then another interesting study, Immuno-Sarc2. This was on a really rare subtype of soft tissue sarcomas. This were the results from clear cell sarcomas. We do not have an approved treatment for these sarcomas. We do know that chemotherapy does not work in these sarcomas. So here in this Immuno-Sarc2 master trial, a combination between a targeted therapy, sunitinib and nivolumab, was used. And also here we had a really promising response with a median progression-free survival that was higher than described for the medication that was used till now. So thereafter we have also the update on the botensilimab and balstilimab in patients with refractory metastatic sarcomas. And here the report was on very promising overall response rate of 23%, especially in patients with visceral angiosarcomas that are usually not known to be that good responding to immunotherapy, and also in some others, immune cold tumors like leiomyosarcomas and the differentiated liposarcomas. This combination of drugs looked quite promising. And the last for the soft tissue sarcoma session was the multi-sarc study, the precision medicine study that demonstrated that the integration of NGS upfront to guide personalized treatment is also feasible and makes sense in sarcomas. Then we come to the bone sarcomas. Here we have first the conventional chondrosarcomas with the IDH1 mutant inhibitors. Olutasidenib was introduced here with this drug was showing a promising clinical benefit rate of about 60%. And it was, we concluded that it's of course worth further investigation in the subtype of conventional chondrosarcoma, because here the results were specifically promising. Then another study on a targeted therapy with apatinib in combination with chemotherapy, gemcitabine and docetaxel in osteosarcoma patients before surgery. It was quite an interesting study because it showed that this combination is really safe, even though side effects like bleeding were expected. And they showed quite a high rate of patients that were the surgery of pulmonary metastasis was feasible treatment. Then we come to the GIST tumors. Here we had the LENVA-GIST study, also a very interesting study on lenvatinib, which was used in at least the patients had to have 2 treatment lines before this imatinib and sunitinib, but the majority of patients also had regorafenib, 80%, and even 50% repritinib. So it was a heavily pretreated population of patients that was included in this study. And the primary endpoint in this study was also met. This was a placebo-controlled study with the progression-free survival being significantly higher than for the placebo group. There were 2 more studies on GIST. One study with Olverembatinib in patients with SDH-deficient gastrointestinal stromal tumors. It was a phase 1 trial, very promising results for a subtype of GIST where the other treatment does not work. So we are already looking forward to the phase 2 trial that is for sure, or even phase 3 going to come. And another combination that was presented from the Polish group, from Piotr Rutkowski, on axitinib and immunotherapy in patients with advanced gastrointestinal tumors after the failure of standard treatment with imatinib and sunitinib. This was a phase 2 trial, which also showed a promising rate of disease stabilization in also a heavily pretreated treatment group. And last but not least was the update on the study with vimseltinib in the TGCTs. And this was the 1-year follow-up from the MOTION phase 3 trial. And here the sustained tumor responses were reported even after such a long or a longer observation period.